then it will be called as adenomyosis. If these endometrial glands are lying anywhere outside the uterus, then it will be called as endometriosis externa. Now, what happens? There is a breakdown of normal endometrial and myometrial interface. That is why the glands migrate, and the endometrial glands and stroma. So it can be a glandular endometriosis or a stromal endometriosis, which can migrate into the muscle or outside the uterus. So when the uterine adenomyosis means that the endometrial glands have gone into the muscle. Okay, and this gland, they contain both the stroma and the glands. So this will undergo menstrual bleeding, and there will be accumulation of menstrual blood in each of the menstrual cycles. So the menstrual cycles will be very painful, and they can be mistaken for fibroid when we do an ultrasound. So this is a normal uterus when the endometrial glands are only there. This is the adenomyotic uterus when the endometrial glands are in the muscle and they are bleeding. So this is a very painful condition for the patient. And patient will be like having pelvic pain, painful periods, heavy periods, and painful intercourse and dyspareunia, and she may not be able to conceive. So there are two types of painful periods. One is the congestive dysmenorrhea and the spasmodic dysmenorrhea. Both happens in adenomyosis. So in their pelvic, the reason for congestive dysmenorrhea is pelvic congestion. Congestive dysmenorrhea will start before the menses and it will relieve after the bleeding starts. Whereas spasmodic dysmenorrhea is the dysmenorrhea of uterine contraction, which starts with the periods and along with the. So 50% cases of adenomyosis may be asymptomatic. And just we did an ultrasound and we found that her myometrium is showing some increased echogenicity and no differentiation is found between the endometrium and myometrium, and there is no proper interface. But if there is a deeper infiltration and more wider distribution, then patient does become symptomatic. So types of adenomyosis, like it may be adenomyosis can be diffuse or focal. Focal adenomyosis, other term is called as adenomyoma. Now coming to diffuse adenomyosis, it occupies a wider area of uterine muscle and it is seen as asymmetrical areas of altered echogenicity on transvaginal examination. So this is less echogenic than the surrounding myometrium, and color Doppler will show normal blood vessels distribution in the small focal. So it is also called as a walk-through vascularity. So this is how it looks like. So this is the uterine fundus, this is the endometrium canal, and this is the normal thickness of the myometrium, and this myometrium contains some glands from the endometrium, and this is diffusely present in the anterior